Imagine this. You notice a small cut on your foot. It doesn't hurt much. You think it's only a tiny wound. It will heal in a few days. Let's wait. You ignore it, but after a week, the wound becomes larger and it starts to smell. There's a swelling and you need urgent medical treatment. Unfortunately, this is something I see quite often with diabetes. A good news is that many of these problems can be prevented if you recognize the warning signs early. In today's video, I'll explain the early signs of diabetic foot wounds, the common mistakes people make, and the simple steps that you can take to protect your feet. Hello, I'm Dr. Rajeev, consultant, general and laparoscopic surgeon, and a podiatrist in Bangalore. Every week, I meet diabetic patients with foot wounds, some very small, some already quite advanced. In many cases, the problem could have been easily managed or prevented with early warning signs have been recognized. So let's understand why diabetic foot wounds are different. Many people wonder, doctor, why is a small cut such as a concern in a diabetes? The answer is quite simple. There are three main reasons. First, slow healing. The blood sugar remains high. The body is naturally healing process becomes slower. Even a small wound may take much longer time to heal than expected. Reason number two, reduced sensations. Diabetes can affect the nerves in your feet and all over the body. This is something called as diabetic neuropathy. Some people lose the ability to feel pain properly. Imagine having a small stone inside your shoe and walking all day without noticing it, or wearing a tight footwear that keeps rubbing against your skin. Because the feeling is reduced, the injury keeps getting worse without the patient or the person realizing it at all. Reason number three, poor blood circulation. In some diabetic patients, blood flow to the feet, especially the toes and the heel area, is reduced. Blood carries oxygen and nutrients to help wounds heal. When circulation is poor, healing becomes even slower. So remember these three words: slow healing, reduced sensation, and poor circulation. Now, let's discuss early signs that should never be ignored. A wound that isn't healing, even if the wound looks small, if it is not improving over several days, it deserves medical evaluation and assessment. Another sign, redness. Red skin around the wound may suggest something called as inflammation or an infection. This also requires an assessment. Another sign is swelling. If the foot or the toe becomes swollen, do not assume it's because of you that you walked too much or you sat too much. Please get it assessed. Another sign is warmth. If the foot feels noticeably warmer compared to the other part of the body, that means something is going wrong. If any pus or discharge is noticed, yellowish discharge, greenish discharge, or any fluid coming out from the wound, it also is a red flag sign. Another important sign is bad smell. An unpleasant smell from the wound is never normal. Sometimes skin color changes may also be present. Normal skin color, it may be reddish in the surroundings, sometimes purplish, sometimes black. Darkening or blackening of the skin needs to be evaluated for query gangrenous changes. Another important sign is numbness. Some patients do not have pain. Instead, they experience numbness, tingling, burning, some sort of a pin and needle sensation or ant crawling sensation. Another important sign is pain while walking. Sometimes pain appears only after you walk or put weight on the foot. Fever. If you develop fever along with a foot wound, do not delay. It may indicate that the infection is affecting your body and the viral or rather than viral bacterial load is transmitting within your body. Now, let me tell you the 5 mistakes I see almost every week in my practice. Mistake 1, ignoring the wound. Many people keep saying, let's wait another week. Unfortunately, the wound does not wait for you. Mistake number 2, using random creams. Not every cream is suitable for every wound. Using painkillers on wounds can worsen it. Self-treatment can delay proper wound care. Third one, walking barefoot. Even inside the house, small injuries can happen without being noticed. Mistake number 4, improper footwear. Let's say a tight footwear or too compressed footwear, worn out soles are bad. Mistake number 5, waiting because there is no pain. This is probably the biggest mistake. In diabetes, no pain does not mean no problem. Family members, if someone in your family is diabetic, you can help them more than you realize. Many elder people cannot easily examine their soles and their feet. Some have poor eyesight and some may not be able to bend over. Others may not notice changes because of their reduced sensation. Encourage them to keep checking their feet every day or help them do it. When should you seek a doctor's advice? Please seek a medical evaluation. If the wound isn't healing, there is redness or swelling, there is pus or any discharge, the skin around it is changing color, you're developing a fever, any sort of numbness, and you have diabetes that is not getting controlled. Early treatment is simpler than delayed treatment. What happens at the clinic? Many patients worry that every foot means surgery. That is not true. The first step is to understand the problem. We examine the wound, assess the depth, check for infection, evaluate the blood circulation. Depending on the findings, treatment may include wound cleaning, dressing, medicine, surgery, blood sugar control, sometimes a surgery. Every patient is different, so treatment will also be individualized. I want you to remember one simple message. Do not fear diabetic foot wounds, but do not ignore them either. Most serious problems begin as something small, a tiny crack, a tiny shoe bite, a blister, a small cut. When these are noticed early, treated early appropriately, they often manage without much complication. So if you or your loved ones has diabetes, make a foot care part of your daily routine. Check your feet every day, wear comfortable and protective footwear, avoid walking barefoot, and if you notice any unusual things, don't wait for the pain to set in or to seek medical advice. A small wound today should never become a big problem. I hope this video is helpful. If you did, please like this video, share and subscribe for more evidence-based information on diabetic foot care, wound care, common surgical conditions. If you have any questions, leave them down in the comments below. I'll be happy to answer them in the future videos. Thank you for watching and take care of your feet. They carry you throughout your life. Thank you.